Can you tell us your story as to what you've been dealing with for a decade and then what happened last year?
Okay. Well, for the decade, about 2 years after the birth of my children, I experienced a lot of pressure.
Mm-hmm.
Some of it feels, it had a sensation of burning, that kind of thing. Just overall discomfort. Not necessarily had to go to the bathroom more, but it was less when I did, when I would try to go to the bathroom. So I went to my urologist, and they determined that it was, they did a scope, and they determined that it was interstitial cystitis after ruling out the other things.
Other things, right.
And so they said, hey, you know what? There's not much we can do, but we do have this new drug that's on the market. So I started taking Almiron.
Mm-hmm.
And sometimes, most of the time I took that orally, but sometimes we would inject it right into the bladder, which they just did right in the office.
Mm-hmm.
And it seems like sometimes those things would help, but sometimes they didn't.
Mm-hmm.
So just kept taking the Almiron.
And can I ask, how much were you paying for the Almiron a month?
Oh, yeah. $400.
For a month?
Yeah.
Okay. So
Yeah.
then last year you were dealing with this, and then last year what new symptoms you started having?
I started having sensations in the lower pelvic, into the the clitoris area, and it was a constant. It wasn't particularly painful, but it was constant. And then if it lasted for a while, things would start to feel, inflamed or hot, kind of like it had before.
Mm-hmm.
But this sensation was new, completely new. Never had that before.
Mm-hmm.
And that's when I came. I did go back to my urologist, and we did a hydro
Distension, yeah.
But I was still having trouble after
Issue.
that. And so
And then you also had a OBGYN workup, just to clarify.
that's right.
And
I
then
did.
you had everything was normal. Your pelvic
Everything was-
exam was normal, your pap smear was normal.
Exactly.
And you were still having issues, and then you came and saw me, and
Yeah.
then what happened? What intervention did we do?
We did physical intervention with certain exercises, particularly the back, we call it back extension, where you lay flat and you lift up and you try to get.
So that is extension in line. So you were lying on your stomach and then
Yep.
doing the back
And you
stretches?
stretch up.
Right.
You hold your pelvis. It's very important to hold your pelvis down
Right,
and do it right.
right,
I learned that. So.
right. And then what other exercise? I gave you one more exercise apart from that.
The neck exercise.
No, the elbow one. You remember the
This
thoracic one? Yeah.
I call that the neck one.
Okay. All right. So you were doing seated thoracic
Yes.
extension.
Yeah.
Right.
Right.
And so what happened to your pelvic symptoms after you started?
They started to dissipate
Mm-hmm.
quite quickly,
Mhm.
and I was very pleased with the results of that.
Mm-hmm.
And I think I came back a couple more times.
Mm-hmm.
I think I wanted pain medication, and you said no, and so we did the back again, and you sometimes are able to make it a little bit, you can.
So I was doing clinician overpressure, and I
Yes.
was doing lumbar mobilization when you will
Mhm.
come here. And then immediately we will see a response in
Yeah.
your pelvic symptoms.
Yes.
They will dissipate,
They
right?
did.
Or disappear.
Yeah, they did.
Right. So we were clearly seeing a cause and effect.
I would agree. Yes.
Right.
Yeah.
And so what happened with Almiron? So that was your pelvic symptoms. Then what did we do about your quote unquote interstitial
Well,
cystitis?
we reduced the Almiron, and
Mhm.
things were fine, and so we stopped the Almiron.
How often were you doing your exercises?
When I start out, when it's really painful, I do it 4 times
Mm-hmm.
a day. Sometimes even more.
Mm-hmm.
After that, when the symptoms seemed to go away, I really only did them when I started to feel it again, and then it would help, and it would just go away. And
Right.
so,
There was something happened. You went to the hospital for a different reason,
mhm.
and you were in intensive care unit.
Yes.
Will you describe that situation to us?
Yes. I was there for a different reason, and going through that, and that was fine. But I started to feel that familiar sensation in my bladder
Mm-hmm.
and the hotness and the sensation in the clitoris,
Mm-hmm.
which drives you crazy.
Mm-hmm.
And I told my nurse, I said, "Get me some drugs. I need some drugs for this."
Mm-hmm.
And so they called you, I
Mhm.
believe,
Mhm.
and you came in and you said, "No, we're going to do the back exercises," which I really didn't think of doing because I was
You were in ICU. Yes, yes.
I didn't know what they'd like, and honestly, I thought, "Oh, that's not going to help." You know, this is everything's just terrible right now. So,
Mm-hmm.
but you came in and you said, "Let's do them." We did them, and I mean, pretty much immediately that pain went away, and I was so relieved because I thought, "Holy cow!" You know,
Mm-hmm.
I don't want to deal with two things at one time here. So,
Right, right. For how long were you taking Elmeron before we intervened last year?
8 years, 9
8
years,
or 9 years,
yeah,
right, right.
yeah, a long time.
And will you share with us how much response did you have when you were taking Elmeron?
It's really hard to say for sure.
Mm-hmm.
But you know, sometimes I would have wonderful 2 weeks, and then boom, something happened, and I'm still taking the Elmeron.
Mm-hmm.
So it does come back during that. I
Mhm.
mean, it doesn't, and it never got rid of the pain for more than 2 or 3 weeks.
Mhm.
I have to do something, you know.
Because you were
Change it.
taking some other pills also for your issues. You were taking hydrocodone also.
I was at one point, yes.
Right.
Yes. And
Okay.
then they decided no.
All right, cool. So you are comfortable with it now. So,
I am.
So are you surprised that your pelvic issues were coming from your back?
Yeah, because it felt like they were coming. I mean, you're just so sure it was coming from my bladder.
Mm-hmm.
Am I surprised? I think I was a little bit,
Mm-hmm.
but I think maybe later I thought to myself, yeah, maybe I should have known. Because do you remember the time that I hurt my foot
Mm-hmm.
and I said, my foot,
Mm-hmm.
and we did those exercises
Mhm.
and my foot felt better.
Mm-hmm.
So, so in a way, sitting here, I should say, no, I'm not surprised, you
Mhm.
know, but
Mhm.
I think I was. I think I was really surprised how quickly the exercises were able to relieve the pain.
Right.
Yeah.